Now, hang on one second.
Uh-oh. Cameraman not ready.
Yeah, well,
I gotta have the cameraman for this.
okay, that looks better.
Right?
Okay.
Alright, well, most of you guys know me, but I'm Tom Paskowski, and a little bit of my background is I'm an EMT, and I've been an EMT since 2012. And I've also been CPR certified since my freshman year of high school, so about 6 years. And I'm given this, I'm sure most of you have probably taken a CPR course once in your life, and this will be more of a refresher for a lot of you, and some of you who might not have had it. This will be some information that will hopefully help you save a life in the future if it comes to that. So I know I had to refresh for this speech because things change every year as far as what the procedure for the compressions and everything. They're starting to turn to more basically just compressions instead of compressions and ventilations for people who are uncomfortable with ventilations, but still compressions and ventilations are still the #1 thing to do. So I'm going to give you a scenario. Say you're at home and your husband or wife, you find them and they're on the bed and they're not breathing and they look blue, there's no breathing, and you can't find a pulse. And one way you find a pulse is you have a carotid pulse right here. You follow your jawline down and you go in a little bit and your carotid pulse is right there. If they don't have a carotid pulse, if you can't feel it in 5 seconds, don't keep doing it. You need to focus on the CPR. So the first 3 things you have is airway, breathing, and circulation. We've been taught that in EMT and CPR, and you're going to assess, is their airway open? Okay, it's not open, they're not breathing, and they have no pulse. You're going to then do CPR. So how you do CPR is you take your palm and you put it, you're going to put it about right here. You take your palm, and what we've been taught is you don't put your fingers all over the person like this. You're going to put your palm like that and interlace your fingers. You're going to lock your arms out, and the compression and the ventilation, the ratio for this is 30:2, and what you want to get is 100 compressions per minute. So if I'm doing 30 compressions and 2 ventilations, it's going to look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. So that'd be 30:2, would be compressions and ventilations. As far as the ventilations go, you can do the method, which is the head tilt chin lift, and you basically tilt the head back, open the mouth, and pinch the nose. It's pretty simple. Sometimes we're told, people might have spinal injuries. Sometimes that move can be altered a little bit, but if they're dead, it doesn't matter if their spine's messed up. So just gotta remember the 30:2. Same for a child. It's going to be 30:2. Some children are bigger now. The only thing is that with a smaller child, you can use one palm instead of both. But there's basically no difference between child and adult besides the fact of one palm, and their lungs aren't going to be as big as us. So with child, you might have to use half of a breath that you would use for an adult, but there's basically going to be no difference. An infant, going to be the same way, 30:2. Their lungs are very small, so you're going to use 1/4 of the breath you would use for an adult. You're going to be looking in all these people, adult, child, or infant. You're going to be looking for the chest to rise. That's it. If you push too much air in, it'll go into the stomach, which is called distension, and that's going to cause problems. I wouldn't worry about that or not because they're dead, and you just need to give them CPR. The main reason why people don't give CPR is because they don't feel comfortable doing that. And there's 4 out of 5 cardiac arrests happen at home, and it's 2 to 3 times more effective for somebody to come alive again, basically, if they have early CPR. So if you never start CPR, they have no chance. If you have bad CPR, if you're just like this, that's better than nothing. So just make sure that you just stick with 30 to 2, and hopefully you can save a life. That's CPR. Heimlich, I'm also going to go over. So say you're in a restaurant, and there's a guy sitting 3 tables down from you, and he starts to choke. He's got the universal sign for choking. He's turning blue in the face. If he's not breathing at all, no sound coming out, he's choking. If he's gasping, he's not choking. You don't, some people, I mean, I've always been taught as a kid, you want to hit them on the back, if they're making noise, and that can actually lodge the object in your throat. So encourage him to cough. If he is choking, ask if he can help. And if you can, what you're going to want to do is take your thumb, you make a fist. You're going to find the belly button and put your thumb right above the belly button. And you're going to do inward and upward thrusts. And that's it. If he goes unconscious, then you're going to do CPR. In all these situations, you're going to call 911. That's probably going to be, I should have said that there earlier, but that's going to be one of the first things you do. If you're at home and you're alone and your husband or wife has, they're pulseless, you're going to want to call 911. And I recommend putting it on speaker, because it'd be kind of hard to, talk on the phone and try to do CPR at the same time. So put it on speaker and talk to them, and more than likely they're going to give you a refresher too. They're going to run you through this, and hopefully you help save a life. So a couple considerations with Heimlich is if somebody's pregnant, you're obviously not going to push on the baby at all. So you come up in this area and you're going to be about right here. Same thing, in and up, but you won't be in this area. Same thing with obese people. If you can't fit your hands around them out here, you go to where you can fit your hands around them. Same thing. But like I said, if you don't do CPR, the person has no chance of living, besides God's will, but they have no chance of living. So if you perform bad CPR, it's better than nothing. If you perform good CPR, put your palm, lock out, 30 to 2. It's very physically demanding, but it's not complicated. So there's no reason why someone can't do it if they have the knowledge to be able to do it. So just make sure in the future that some of this knowledge that I've refreshed or given you or whatnot, if you come to a situation where nobody's doing anything, you should be able to help. So that's really about it. So does anybody have any questions? Yes.
Do you put on the pressure on the stomach or the chest?
It's for Heimlich or CPR?
Yeah.
Heimlich?
Yeah, the first
CPR.
CPR.
CPR is going to be the chest.
The chest.
So it's going to...
Right above your stomach.
Well, yeah. It's going to be like right here.
Oh,
Right in that.
in the hard part.
Yeah, and one of the things is with CPR that... One of the things that some people don't know with CPR is it's very physically demanding, and you may break someone's ribs. It's very possible to break somebody's ribs. I always hear about it, and don't think that just because you hear a crack, you're doing something wrong. That crack is not going to change the fact that they're dead, and the fact that you are doing CPR may bring them back. So, any other?
Yeah, you mentioned earlier, if they're on a bed or in a chair, do you want to get them to the floor?
Oh yeah. If they are on know, let's say Bob is sitting on this chair. You're not going to be able to perform adequate CPR on the chair. You're going to want to, he's dead, drag him off. He's dead. So get him off. If he's on the bed, for somebody who's bigger, and if you can't move him, you can perform CPR on the bed, but the better way would be to get them on the floor on a hard surface. Because if you're pushing against something, if they're on a water bed, you're pushing against a water bed, it's not going to do it. They're just going to bounce up and down. So, but that's about it. Any other questions?
So once you drag them off there, don't worry about their head. You might cradle their head up in the corner. Just
They're
get 'em
dead.
off there quickly.
I mean, they're dead.
Well,
We're taught that in EMT, it would be, if they are still breathing, you would be more careful. But if they are dead, it's going to be an emergency move. So you're not worried about, we hold C-spine, which is holding the spine in place. You're not worried about that. You're worried about getting them back alive. So be as careful as you want, but they're dead, so they need some interventions.
They might, even if anybody wants to try with that, because it does take a lot of pressure.
Yeah, if anybody does want to try with this, this is just a mannequin, so it's going to be quite a bit harder in real life, but this takes a lot of pressure to do. To hear the click and have adequate depth, it's kind of hard. So anybody wants to try, that's cool. Anything else?
Okay.
All right. Well,
Okay, thank you.